Hello, everyone. This group is comprised of Lisette Avila, Karina Guzman, Emily Ayala, Catherine Duarte, and Sarah Valdez. This is our assessment comparison analysis. Our client is Sasha, a 4-year-old girl diagnosed with autism spectrum disorder when she was 3. Sasha's interests include iPad time, bright colored objects, cause and effect toys, and independent play. Her current skills include eye contact, minimal sounds, imitating adults. She's toilet trained, can dress herself, pulls others to indicate her wants and needs, and can brush her teeth and her hair. She currently receives speech and occupational therapy, but has no history of receiving ABA. Caregiver concerns include lack of social skills, deficits in language, aggressive behaviors, and deficits in play skills.
So what is the VB-MAP? VB-MAP stands for Verbal Behavior Milestones Assessment and Placement Program. It is an assessment tool that looks at a variety of skills to understand where the child is developmentally. The areas that the VB-MAP focuses on are MAND, tact, echoic, intraverbal, listener, motor imitation, independent play, social and social play, visual perceptual and matching the sample, linguistic structure, group and classroom skills, and early academics. There are a total of 170 measurable learning and language milestones. They are categorized by 3 levels. Level 1 is 0 to 18 months, level 2 is 8 to 30 months, and level 3 is 30 to 48 months. Also, barriers assessment gives guidance to develop specific strategies for effective interventions and learning outcomes. VB-MAP is measured directly and indirectly, and the age range is any range as long as the individual is displaying deficits in verbal behavior within their 48 months of life.
What is ABLES-R? The ABLES-R is Assessment of Basic Language and Learning Skills Revised. So this assessment helps you identify deficiencies in language, academic, self-help, and motor skills. It can help assess learners from birth to age of 12, but it is recommended for those between the ages of 2 and 6. The assessment is evaluated by directly observing the learner, and the skills assessed are basic learner skills, academic skills, self-help skills, and motor skills. For the ABLES-R, why we wouldn't recommend it for Sasha are a couple of points right here. So first of all, the assessment does focus on academic skills, and right now she's 4 years old, so we don't need to focus on that right now. The ABLES-R also doesn't provide instruction for teaching desired skills, and that is crucial right now for her age range. Since she does lack social skills, we really need to know how to target those areas to help her growth. And the ABLES-R is also not standardized, so the child's performance in an area cannot be compared to any age group.
Our group has decided that VB-MAP would be the best fit for Sasha. This is due to the assessment of current level of MAND, tact, echoic, intraverbal, listener, motor imitation, independent play, social and social play, visual perception and match to sample, linguistic structure, group and classroom skills, and early academics. These were all main concerns of the caregiver. In addition, the barriers assessment allows us to determine barriers that limit the child's ability to expand their skill repertoire. In support of the information provided about the client's strengths and caregiver concerns, the VB-MAP is an appropriate tool to use in determining her current skill level, appropriate interventions to intervene with the deficits, and track her progress during and after intervention. However, the VB-MAP does not include self-help skills, although the client is already engaging in hygiene skills that are appropriate for her current age. When assessing Sasha, she may demonstrate skills above a typically developing 40-month-old individual, which surpasses the VB-MAP scope of measurement. However, if ABLES was used in addition, these areas could be continued to expand past 48 months, measuring skills up to 12 years of age.
Okay, so like Karina said, after looking closely between the 2 assessments, we decided that the VB-MAP would be the best choice for Sasha. Conclusions of this assessment showed her having lower scores in manding, independent play, and social skills. After looking at where she is on the VB-MAP, we are able to determine the next skill for her to work on and move through the guide until she masters that skill. When she shows progress and meets requirements for these skills, we will introduce a new skill for her to work on. And this information will be collected on a data sheet using a new color. This data will be graphed, analyzed frequently, and Sasha will be retested every 6 months to choose the next intervention.
And that concludes our assessment comparison analysis.